Good afternoon. I want to thank you all for joining us today and for the Rochester Media Press Corps for working with us to be able to do these press conferences again in a safe way to be able to promote and model good social distancing practices. Last week, the President and CEO of the United Way of Greater Rochester, Jaime Saunders, Congressman Joe Morelle, and Jennifer Leonard from the Community Foundation and I made an announcement to kick off a community effort to be able to bring together nonprofit organizations and community-based organizations from around our community to create a volunteer portal and also a donation fund to help support those who are most in need of this community. Today, we're coming back to provide an update on where we are with that and be able to give you a few other updates on where we are in Monroe County related to the coronavirus. As you know, COVID-19 is impacting our entire community. And we are all in this together, and we are going to get through this together. At this stage in the spread of the virus, social distancing is a critically important action that we can all take in order to flatten the curve. By flattening the curve, we can collectively lessen the impact on our healthcare providers and ensure that they have the capacity to deal with those individuals in most need of care. This is about protecting the most vulnerable people in our society. People without symptoms can still carry the virus, and the only way to stop the spread is for those of us who don't need to be outside of our homes to stay home. People have long asked me, how long is this going to last? And is it going to, and how long are we going to be out of school, and how long will our non-essential businesses be closed? The best answer I can give to that is it depends on how well we listen to the medical professionals who are giving us the advice about social distancing and staying home. The better we are at slowing the spread of this virus and the better we are at staying home and protecting the most vulnerable people in our community is the measure by which we know how quick we can come out of this. So it's incumbent upon all of us to follow those recommendations. New York State on pause started yesterday, which meant 100% of the non-essential workforce in our area must stay home. Here's what that means. In addition to not being at work and working from home, it also means that we should not be visiting our friends and family in person and in large gatherings. We need to stay emotionally connected. We should be FaceTiming. We should be using programs like Zoom and WebEx and other video conferencing technology to stay connected with individuals and our family members and friends. And if we need to bring someone food or other supplies, we should be leaving it on their doorstep. Those are ways we can all still be connected and be able to take care of one another and be able to still care for each other, but still be able to be in contact. We also need to limit our trips to grocery stores and other places to when it's only absolutely necessary. Make a list in advance and cut down on our browsing time. We should consider using delivery services, and we should wipe down our carts and touch screens after we use them. But it's also just as important to get outside and get some fresh air. Our Monroe County parks are still open, but it's important to use them safely. Our playgrounds and facilities are closed, but when outside, you still want to keep your distance and avoid games and activities that require close contacts. And when you return indoors, wash your hands with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer. But I still want to encourage you, go out, take a walk, just practice good social distancing techniques and keep our 6-foot space between us and our neighbors. I also want to take an opportunity to highlight the amazing community response we've received across Monroe County. Last week, or earlier this week, we launched an effort in partnership with the Chamber of Commerce to call on local businesses and organizations who are looking for ways to help donate supplies that our local healthcare providers are in need of. The supplies that we're looking for include disposable gowns, disposable gloves, face masks, protective eyewear, and sanitizing wipes. If there's anyone in our community, and business community and community at large, who's in a position to donate supplies, they can do so by emailing covid19@monroecounty.gov. Again, that's covid19@monroecounty.gov. The Monroe County Department of Environmental Services can help arrange for the donations to come into our center, and we'll make sure we get those to the healthcare community. The same goes for local manufacturers, and we've had lots of them reaching out looking for ways that they can ship their production to create supplies that are most needed. If you have the capacity and desire to do that, again, please email us at covid19@monroecounty.gov, and our team at the county will connect you with the information that you need. Monroe County is also launching an effort to connect the essential businesses that are still functioning and operating in our community with those additional workers who are now seeking employment, with job seekers across the community. We have businesses that we know are expanding capacity because they're providing those essential services and much needed services, but we also have residents now who are looking for work. So we're asking those employers who are in need of all job seekers to utilize Rochester Works to connect. If you do so by visiting www.monroecounty.gov/works. Again, it's www.monroecounty.gov/works. And what Rochester Works will do can serve as the portal for our community, where businesses who are looking for employees can sign up through Rochester Works and post their jobs, and employees and job seekers in our community who are looking for work can find those jobs right through that website as well. So we've created a one-stop shop working with our partners at Rochester Works to be able to connect businesses who need to staff up in this critical time and workers in our community who are looking for those jobs into one single portal and one single space. Our community has also seen an outpouring of volunteer support from individuals packing boxes for FoodLink and to those making calls to check in on our senior residents. There are so many ways to volunteer. In the United Way and Jaime Saunders, their president and CEO, will be speaking about that in a few minutes, but I want to thank all of the individuals who've been signing up and volunteering in a safe way across our community to protect our most vulnerable residents. I also want to thank SUNY Brockport President Heidi McPherson. As you know, SUNY Brockport is closing down the dormitory that housed quarantined travel abroad students. The Brockport community was among the first to step up in the face of the challenges of COVID-19 that has been presented to us. And President McPherson has announced that she is donating leftover supplies to Monroe County, including 7,000 hospital gowns. So I want to thank President McPherson and the community of Brockport for their help and support. I also want to thank Causeway, partners in Napier, the University of Rochester Medical Center, and Rochester Regional Health, along with nearly all of the local media outlets, are teaming up to create a broad, community-wide educational campaign to help everyone understand what they can do to help contain the spread of the virus. That campaign is rolling out as we speak, and I want to thank again all the partners for working with us on that. Last Friday, I signed an executive order which extends the due date for the third installment of town and county real property taxes to April 30th. It also prohibited the in-person tax payments at all town and county buildings for the duration of the state of emergency. Along with that, we will also be waiving online processing fees. So in essence, all the property tax payments for the county taxes, town and county taxes that were due on March 30th are now extended to April 30th. You cannot pay in person, but you can pay by mail, Dropbox if that's available in your town or locality, and you can also pay online with no additional fee. The last thing I want to highlight for our community members is that we've received a number of questions and concerns over whether or not their employer is following the directive from Governor Cuomo regarding essential and non-essential functions. The New York State Attorney General's Labor Bureau is now fielding those concerns and investigating those issues. If you feel like you have a question or need to talk to someone about whether your employer is following the rules of the 100% shutdown, you can contact that office at 212-416-8700. Again, it's 212-416-8700, or you can email them at labor.bureau@ag.ny.gov. Again, that's labor.bureau@ag.ny.gov. You can also always call the Monroe County COVID-19 Hotline at 753-5555. And again, it's 753-5555. And we have folks answering those phones who can answer questions and direct our residents to resources that they need available. And they can also use our email address, which is covid19@monroecounty.gov. monroe.gov. I want to also thank Governor Cuomo for the leadership he's been demonstrating and advocating for the needs of our residents across New York State. And I am incredibly grateful for the partnership of local elected officials from all levels of government here in Monroe County and across our region. I am hosting daily calls with countywide elected leaders countywide to ensure that they have the information they need to bring to their communities and spread the message that we talk about here today. I'm also incredibly grateful for Congressman Morelle and his efforts linking us with the service providers we need here, and his efforts with systems integration work that is helping to bring the community-based organizations together and make sure that we are coordinated with our community-based organizations and our hospital systems day in and day out throughout our region, and making sure that he's advocating for the needs that we need here in Monroe County. So I want to thank him for his work, and I also want to thank Mayor Lovely Warren for her partnership in working together to keep and protect the citizens of the city of Rochester safe. This is what our community does best. We come together in times of need. We all are in this together. We'll get through this together, and we all have a role to play, whether it's from our hospital workers and the folks in healthcare who are keeping us healthy and working with folks who are facing COVID-19, or if it's our law enforcement, EMS, our fire crews who are out there, whether it's folks working in essential businesses in the grocery stores. We need to say thank you. And to everyone else in this community who's home, we have that role to play, is to stay home, because we need to slow the spread of this virus so that it doesn't unduly stress all those other systems that need to continue to operate. So thank you. And next I'd like to bring up to the podium the President and CEO of United Way of Greater Rochester, Jaime Saunders.
Thank you, County Executive Bello. Good afternoon. In just a short few weeks, so much has changed. For the past several weeks, your United Way has been working in partnership with our government, businesses, and nonprofit leaders to respond to this crisis and to support a coordinated community response. Many businesses and individuals have asked, how can I help? And many have asked, where can I find help? For individuals and families who need help, please call 211. We are fortunate to have this long-standing central resource in our community that is available 24 hours a day, 7 days a week, to connect people to services across our community. As you can imagine, call volume is extremely high at 211, especially during the day. If you are able, please call 211 after 5 p.m., as lines are more open in the evening. You can also text them at 898-211 or visit the webpage at 211lifeline.org. To the people at 211 responding to those calls, texts, and website inquiries, we thank you. To the media that has been sharing constantly breaking news and updates with all of us to keep us informed, thank you. To our healthcare workers who serve on the front lines of this health crisis and continue to care for those who are suffering, thank you. To our partners in government who continue to ensure essential services are provided and are working hard to keep us safe, thank you. To our partners in business, to the employees but providing essential services, thank you. And to the nonprofit organizations who serve our community every day but currently find themselves stretched beyond measure, thank you, and stay strong. Our human service providers remain on the front lines, providing critical care and support, from homeless shelters to residential facilities, to emergency food distribution, to older adult services, to safety from domestic violence and child abuse, to supporting children and adults with intellectual and developmental disabilities, and so much more. Human services are just that, serving our community's people through a vital network of critical and essential supports, and they are hurting. Local human service organizations are facing staff and volunteer shortages, funding shortages due to canceled fundraising events and closures, supply shortages, and concerns about the unforeseen challenges just around the corner. Yet, they continue to serve this community in remarkable ways. Over the past week, FoodLink secured the convention center as a safe and spacious location where more than 10,000 emergency food boxes were assembled, and this will continue throughout the crisis. Goodwill has deployed their teams from their now closed retail locations to assist in picking up and distributing critical supplies to our other human service agencies. The Catholic Family Center and Lifespan continue to effectively and efficiently manage intake thanks to donations received from the community of laptops and other equipment. Medical Motors, whose ridership is now down, has been redeployed to provide transportation for pediatric patients who are struggling to make critical appointments. And all of these feats and so many more have literally been achieved in days. And this has been made possible by the help of the community through a coordinated community response. The pressure on these organizations to do so much with so little is why every single person has a role and why every person can connect with United Way for resources on how to best help the community. There is a role for everyone, and we need an army of good. You can donate now to the Community Crisis Fund by texting Crisis Fund to 41444 or give online or by check with details at uwrochester.org/crisisfund.
Can you pause for just a minute? Those of you media members on the call, please make sure you are on mute. Thanks.
The United Way is proud to partner with the Rochester Area Community Foundation to launch the Community Crisis Fund just 1 week ago to pool funding from the community to provide rapid and flexible support to our community's nonprofits. With commitments from local foundations and individuals, the fund has raised more than $2.3 million in the last 8 days alone. Grant applications opened yesterday with more than $900,000 in requests in 24 hours, and we know the need will continue to grow. This is going to be a long journey, and to make sure that our community thrives, we need your support to take care of our most vulnerable. We also know a secondary crisis can happen when some nonprofits are overwhelmed by offers to help and they cannot keep up, while others do not have enough to get by. To help coordinate volunteer and supply needs, please visit Volunteer United COVID-19 portal, which connects caring community members with safe in-person and virtual volunteer opportunities and supply needs in real time. You can volunteer from your couch, you can volunteer safely in person, and you can ship supplies by delivery to a critical agency that needs help. For example, right now, the Catholic Family Center needs volunteers to assist with increased cleaning regimens, is searching for licensed practical nurses to support medication distributions at their residential sites. Jewish Family Services needs volunteers to help with collecting and distributing food, placing check-in calls, making cards, and assembling Passover to-go food baskets for those unable to leave their homes. Starbridge needs paper products, cleaning, and supplies. Willow Domestic Violence Center needs new takeout containers to deliver meals to the residents staying in their shelter, and on and on. Most of our nonprofits are in need of laptops and other technological equipment, and FoodLink will continue to need 40 volunteers a day for the foreseeable future. There are many ways that people can step up and help, and we ask you to look at uwrochester.org/COVID volunteer, as it is updated on a regular basis. You can also sign up to be on a wait list for when additional needs, which will be coming, become available. We are proud to partner with the Rochester Chamber of Commerce and with Monroe County to coordinate supplies and donations, as stated earlier, and anyone who has items to donate, please look at uwrochester.org/COVID volunteer to make those available. It can be confusing to hear flatten the curve and stay at home. Yet we also need critical volunteer support. There is a way to do both, and volunteers are considered essential services. There are ways to do it safely, and I want to thank Monroe County Department of Health and Commissioner Dr. Mendoza for providing safe volunteer guidelines, which are available at uwrochester.org/COVID response. Your support for this community is needed and is more important than ever. There is no business as usual in the foreseeable future. So in the meantime, stay healthy, stop the spread, give, volunteer, and engage. This is our moment to be part of helping and part of shaping the community we need and believe in, and our community needs you. It is now my pleasure to introduce Congressman Joe Morelle.
Members of media on the call, please remain on mute.
Thank you. In our darkest days, Americans have always demonstrated a limitless capacity to come together and lift each other up. This crisis is no different, and we will get through this unprecedented challenge by remaining strong, united in spirit, and resilient. We are incredibly fortunate in this community to have such dedicated partners like County Executive Adam Bello, who has learned the hard way on-the-job training and his new responsibilities. I don't think anyone could have imagined within his first few months of taking the helm of the county government that he would face and his team would face such extraordinary challenges. But they have been beyond what any expectations were. They have worked tirelessly. We are working together in a coordinated fashion, all levels of government working together, and it is his leadership and his team's leadership which are really showing the way in this community. I also want to thank Jaime Saunders and the United Way for their incredible leadership. We are blessed. I often say what an incredible privilege it is to represent Monroe County in the House of Representatives, not just because it should be a privilege to serve in the House at all, but to represent this community, which has an extraordinary legacy and remains today, to have some of the great leaders, thought leaders and community leaders, and Adam Bello and Jaime Saunders exemplify that, as does Bob Duffy and the Chamber of Commerce, all groups working together. And I also want to thank Governor Cuomo. I speak to him nearly daily, continue to thank him for his leadership of the state and his leadership nationally. I mean, he is the clear voice throughout this country on what it takes to fight such an incredible and yet invisible enemy, and has called on the federal government, has nudged and pushed and done whatever he can to protect New Yorkers and to lead the way. And I am grateful to him for his leadership and his longtime friendship. And also Vinny Esposito, who represents the governor locally, who is in every single call that the county executive and I and Jaime Saunders and others are at. So I want to thank everybody, and particularly want to just point out the incredible bravery and courage of our healthcare workers, starting with our health department and Dr. Mendoza, all through every single man and woman who is working in our hospitals, our healthcare facilities, trying to care for those who have suffered from this unprecedented challenge. We should also be grateful for the many ways that the community has stepped up. The county executive mentioned our community-based organizations, and we are working together and coordinated as we have at no time in our history. People have come together, are linking together, are talking on a continuous basis to make sure that we are coordinated and we're reaching out to the people that we need to serve, whether that's people who have stepped up to provide food assistance, and I can't not mention FoodLink and the incredible work they do and all the other food cupboards and pantries around the community, to everyday people offering to volunteer to make sewing masks at home, medical staff who have stepped up, people, we talked about distilleries who are providing much-needed hand sanitizer. The list goes on of companies and entrepreneurs in Rochester who are stepping up every single moment of the day to offer their help and their support to get us through this. And we are in this together. We may be apart physically, but we are in spirit, resilient, and together, and we need to remain that way. And the initiatives that the county executive and Jaime have discussed are critical steps to helping the community respond to those changes that we've experienced as a result of this virus. And I encourage everyone to think about how you can get involved safely involved. And I wanted to underscore what Jaime said, which is while we are obviously stressing repeatedly social distancing, the need to stay at home, that is not mutually exclusive of volunteering and doing it in a safe and thoughtful way, and we can help people guide through that. We all have a role to play in limiting the spread of this disease and helping to support vulnerable families and bolster our local economy. And I'll just mention, at the federal level, we've passed emergency appropriations. We've passed a second bill aimed at providing support for paid family leave and paid sick leave. Depending on who you listen to, we're either at the 2-yard line or the 5-yard line and getting a third massive support for American families. I don't know which yard line it's on, but we're told it's in the red zone, and I'm in touch with my colleagues literally throughout the day as we balance both federal response and local needs, and we're trying to do both. So I'm pleased with that, and we'll have more to say in the days ahead, and hopefully by the week's end we will have conferred and gotten a deal, and the president will have signed that. But at the end of the day, we're all working every day with our partners at all levels of government to ensure our families in the community have the support and resources they need to get through this unprecedented public health crisis and the resulting economic crisis that the virus has brought to us. So anyone with questions, obviously we've named a lot of sources that people can go to. Much of it is redundant, and we want it that way because we want people to be able to go to many places to get those resources. But if people go to our website, www.morelle.house.gov, we have sources and links to all these resources as well. So again, to the county executive, much thanks for his incredible leadership, and to Jaime Saunders and the United Way of Greater Rochester, who always lead the way, and to our healthcare workers. Let's say a prayer and make sure we all get through this safely and soundly. Thanks so much.
Okay, great. Thank you, Congressman, and thank you, Jaime Saunders. I think now we'll take some questions, I'll have Julie Phillip can moderate any questions that the media might have.
Okay, I'm going to call on you each. You'll have one question and a follow-up if you choose. You may ask them of anyone who spoke here. So we have the county executive, we have Jaime Saunders from United Way, and we have Joe Morelle from Congress. First up is Jeremy Moule from City Newspaper.
Hi. I guess one thing I'm hearing that's absent from this, and I know it's been brought up as an issue, how is the county responding to the homeless population?
Thank you, Jeremy. Our Department of Human Services has been working with shelters in our area to make sure that there's a proper food delivery, hand sanitizers, things like that, but also working on social distancing techniques there as well, using Code Blue to place folks in other settings in hotels and motels and things like that we would do during a normal Code Blue situation, to be able to cut down on the density of folks in the shelters and be able to practice good social distancing.
Do you have a follow-up, Jeremy?
Not at this time.
Okay. Patty Singer from Minority Reporter.
Hi. I heard Jaime talk about ways of very different ways of volunteering. But if we don't have population testing to know how much of this virus is in the community, and people can be asymptomatic, like we learned with the city school district earlier with our center's food distribution, how do we know that the people we have out volunteering are not exacerbating the problem?
So we have guidelines on safe volunteer practices, which is, for an example, at the convention center, it's wonderful that they offered that space so that we are able to pack with Food Link those boxes, still adhering to the 6-foot parameter and distance. Volunteering is considered an essential service. It is critical supports, just as we think of healthcare workers, as we think about making sure that our older adults have deliveries and support, that still stands. And so there's safe guidelines and practices that we should all continue to abide by.
Do you have a follow-up?
So, the follow-up. So are volunteers who are doing any in-person work being screened, temperatures taken, being asked about anything like that so that somebody who was fine the day before and comes back hasn't developed something?
That depends on the site in terms of what the intake procedures are for the various locations. So the question around shelters, for example, have extra special precautions that they're taking place for those who have intake. It is, again, part of the responsibility and the role of each of us as individuals. If you are having symptoms, if you have any concerns, or if you're part of an at-risk population, you should not be volunteering in person. And we should, again, adhere by all the safe guidelines for volunteering. That is in practice. Again, volunteers, as a volunteer army, if you will, is part of essential services for the community, and we all have to abide by those guidelines.
Thank you.
Thank you.
Barbie. Our next question comes from Jack Watson at News 8.
Hi, this is for the county executive. Governor Cuomo stressed that the apex of this virus is really a few weeks away. The worst of the virus is really a few weeks away. As far as our local resources go with dealing with it here, how many hospital beds are open for us right now? How many ventilators do we have? Are we equipped at this point to be dealing with a worse number of cases 2-3 weeks down the line?
Yeah. Jeff, that's a really good question. We are blessed here in Rochester to have two really fantastic hospital systems. And over the last week, I have had daily calls with both hospital systems on the same call to talk about the surge capacity and their supply needs and things like that to make sure that we can surge up using the governor's recommendations. Both hospital systems have produced plans that they're submitting to the governor's office to meet the requirement that the governor set out to be able to increase our capacity by, I believe, about 50% and start hitting those targets. And they're doing it in a way that helps build it out in what I would describe as concentric circles so that we have the capacity to build out our beds to meet the need as it grows, along with the supply needs, personnel needs, and timeline that it would need to build out to meet those goals. So we've been working very closely with them to do that. I have confidence in the healthcare systems that they could do that, but it's a conversation that's ongoing every day, and it's a really good collaboration between them. To your point, though, about how long this will take in a few weeks, the one thing that I want to be clear about with the public, too, is that is something that, while it seems like it's out of our control, we all do have a role to play to shorten that time frame and to make sure that that large surge capacity that is the worst-case scenario doesn't happen. And the way to do that is to stay home and to follow the recommendations of the 100% shutdown. The more that we can do, we hear that term flattening the curve a lot. So when you flatten the curve and spread out the time period by which people will contract the virus and spread the disease, it helps the hospital systems be able to stay on top of it and be able to manage the cases that come in there. We report those every day, how many of our infected folks that we've gotten a positive read from are currently hospitalized, because I think that's an important statistic that we need to follow, because that'll tell you that the health of our hospital systems and the community and our ability to manage that.
And as a follow-up to that,
Yeah.
County Executive Bello, President Trump has stressed that he wants to see the country return to normalcy by Easter. Do you think that's feasible, at least at a local level?
I think we would all like to see a return to normalcy as soon as we can, but I don't think that putting deadlines on it like that is the way to do this, because it's going to give false expectations on behalf of the public. This is going to take time. This is not a 1-week break from school or a 2-week break like we had over the holidays in December. This is something that is going to take weeks and weeks, and we don't know when it's going to end, because the health of our community and our population here is what's most important. We will get the economy up and running again. I have full faith and confidence in that, but we need to keep people safe and come out and get through this. And we will get through this, and we're going to get through this together. But again, that's why I said it's also very difficult to say how long it will take, because that depends a lot on the folks who are watching this right now at home. How long this will take depends on how well we, as a community right here in Monroe County, take to heart the lessons that we're being taught about social distancing and what has worked and hasn't worked across the country and across the world.
Thank you, Jack. Brett Dahlberg from WXXI.
Hey, I have a question about jails and detention facilities. What's the status of testing there, and what measures are being taken to ensure the people who stay close to each other in sort of congregate settings like that are kept safe?
So I would refer you to the sheriff to talk about specific measures within the jail that are be taken, but they would be treated inmates just like the population at large. If there's someone who's symptomatic, would be tested. But I would refer you again to the county sheriff on specific measures being taken within the jail.
Do you have a follow-up? Go ahead.
Have you been in touch with the sheriff?
Yes.
On those measures? I mean, is that
Yeah.
something that the county is working on?
Yes, this is something we're working on together, and they have particular measures in place to make sure that they're watching the symptoms of inmates who are in there, making sure they again are practicing good social distancing techniques within the jail, because the last thing we would want is an outbreak to take place in such a confined space. And I also know that the sheriff has made space available within the jail system for individuals who could become symptomatic or who have tested positive. There are separate areas for that so that they can be cared for independently of the rest of the population. Yeah.
Thank you, Brett. Kevin Oklopcha from our Rochester Business Journal is next.
Yeah, Mr. Bello, just wondering and touching on the hospital issue, or have temporary locations been identified, and/or would temporary locations be constructed, or would it be some facility that exists now?
Yeah, if I heard your question correctly, it was, have we identified temporary facilities? That's what the hospital systems have done within their systems to be able to build out and expand their capacity. So they have been able to do that, and they have plans in place that they've submitted to the governor's office to be able to expand their bed capacity within the systems themselves.
Great, thank you.
You're welcome.
Do you have a follow-up, Kevin?
I'm good.
Okay, thank you. Brian Sharp from the Democrat and Chronicle is next.
Yes, I think this is for the county executive. We saw the numbers today. I can't talk medically on those, but I'm just wondering, you were mentioning being in these different calls and such, significant increases that we're starting to see, as well as more tests coming back positive as a percentage of total. Just wondering if you can speak a little bit about putting this in perspective, what you're expecting for the rest of this week.
Sure. So that's a really good question. The increases that we're seeing right now, day over day, in my view, are not unexpected. This is something we've been talking about over the course of the last week, and we've seen a gradual increase, and we've seen a sustained number of new positive cases each day. There is no question, based on what the medical professionals have seen, that we do have community spread here in Monroe County. This virus is out there, and just because we have 105 confirmed cases that we announced just right before this press conference started, there's more than 105 cases in Monroe County. We can be confident of that because we don't know where all of the 105 people who have it contracted it. So that means there is community spread. There are folks at home watching this right now who I'm sure don't feel well and may have this virus. And the best advice is to stay home and call your medical provider. But I also want folks to understand this is going to continue day in and day out. And we are going to have every day a couple announcements of more cases. This isn't going to stop over the next couple days, and it's likely not to stop over the next couple of weeks. And so we're going to be transparent about that and continue to do that, but I need people to understand that this information is going to continue to come at us. And I think that how we process that as a community is we need to understand what our role is to try to slow that spread. How do we each play that role? And I talk about this a lot. It's the hospital and the healthcare workers who are working across the community in the hospital systems and in nursing homes and long-term care facilities. They have a responsibility, and they are working around the clock, 24 hours a day, to keep people healthy. We have our law enforcement, EMS, fire. They're working around the clock. We have folks in government, my team at the Department of Health, the folks at the Emergency Operations Center who are working hard. We have essential services at the grocery stores. Everyone is working so hard at this. But the rest of us who are out there who are not performing an essential service, who are at home, your responsibility is to stay home. The more we can get people to stay home, stop congregating, stop grabbing large in-person social settings, will slow the spread and will make sure that those numbers then don't start to spike. But like I said before, you're going to continue to see this increase. I mean, at some point, we're also going to have, because we know that most people, as Dr. Mendoza has said, who contract the virus will self-resolve at home. And so at some point, we're also going to start to see folks who have recovered, and we'll start to have that statistic as well. But I am paying particular attention to that hospitalization number, and I think if we start to see that increase, that's when we should start to understand that the social distancing that we're doing isn't working. So what I really need people to do is practice social distancing and keep that hospitalization number down as low as we can. So, sorry, Ron, that was a long answer to your question.
Just a quick one. We
Sure.
saw the city report their first employee testing positive. Has the county as yet had any employees test positive? And if so, has that affected operations in any way?
No, we have not had an employee test positive yet.
Thank you, Brian. Our next question is from Tyler Brown at 13 WHAM.
Hello. My question is for anyone who wants to answer it, but the $2.3 million in funds that was mentioned earlier, how long do you realistically think that can last with the amount of need we have in our area?
Sure. Jamie, do you want to take that? Yep.
Not long enough. As we stated, in the first 24 hours, we had $900,000 in requests. There is a governing body that is overseeing that, of the primary funders of that pool, as well as also working with the county and the city to align our response efforts. So it is a coordinated effort for those pooled funds. The goal is to redistribute funds within a 48-hour time period for those that are prioritized. The first batch of applications and how we're prioritizing is really on health and safety and the basic needs. Those are the critical elements. I will say many of our not-for-profits are struggling and are looking to keep their doors open. The greatest support for them would be general operating support. Unfortunately, we do not have enough resources at this time, so we are prioritizing the supply needs that is critical to keeping their doors open, to keeping the staff safe and their clients safe, and to continue operations. We continue to request support of that crisis response fund because it's not just immediate needs, but as the county executive has stated, this will be a long time. This is weeks, many, many weeks to go. And then, of course, as we get past this as a community, there will be the time for recovery. And that is such an important time for us as well to ensure we can support.
Do you have a follow-up, Tyler?
I am okay. Thank you so much.
Okay, thank you, Tyler. Our final question comes from Charles Molyneux at News 10.
Well, this would be for Congressman Morelle. General Motors has proposed using the Rochester Components facility to produce ventilators and switch over production to making them. That's something that you have spoken out already in favor of. Is this something realistic, and what might that do to Rochester's role in the national effort to deal with coronavirus?
Yeah, thank you, Charles. I think as the county executive mentioned, when we meet every day, we, with our healthcare providers, we're on the phones talking about capacity. Capacity is many things. It certainly includes the PPE, the personal protective equipment. It's the testing and the testing reagents and test kits. It's beds, but certainly ventilators has come up frequently. The governor has talked about it at great length, and so Senator Schumer, Senator Gillibrand, and I have encouraged General Motors to get in the middle of this and use the Rochester facility. I will also tell you that we're certainly not ready to announce things, but there's another large group of Rochester manufacturers and researchers and engineers that we've been working with now for well over a week. Our goal is to just meet the demand. And I think, as the county executive has said, if we can flatten the curve and keep people from contracting the virus and not getting sick, then the worst thing that will happen is we have an oversupply of medical equipment. But that would be the best thing that could happen to us. What we're afraid, however, is that the reverse is true, that we're unprepared. And I like to sort of give, sort of thought experiments to this, and make analogies. Where we are today is fine. We have enough equipment today. But as I think of when we used to launch moon missions, you don't aim it where the moon is now. When you launch it where the moon is going to be, and you direct it to where it's going to be days later when you arrive there. And what we're looking at is what could happen in the next 2 weeks, 3 weeks, 2 months, and then ventilators will be in short supply. But if we wait until then to address this, we won't have enough time to build these. Depending on which models, they can become very complex. Others are less complex, and the goal is to try to just build as much supply as we can and to get it get the process as quickly as we can, and really to upgrade facilities to be able to allow them to do that. I would also say we're doing this in conjunction with the governor's office. I've spoken with the governor, spoken with members of his team about ways that we can enhance and use Rochester's great manufacturing legacy to assist in meeting this national need.
And do you have a follow-up, Charles?
Oh, yeah, for Congressman Morelle, you said we're on the 2-yard line for some kind of a coronavirus assistance stimulus package. We thought we had something as we came out of the weekend, and we started hearing about proposals for fuel standards for airliners, or diversity mandates for companies' boards, or subsidies for wind and solar. Now, that may or may not survive the negotiation, but why would any proposals like that even be introduced as we're trying under the gun to come up with a proposal to help deal with the coronavirus?
Well, I think you can imagine, Charles, there's 530-plus people now in the conversation between the United States Senate and the United States House. So people will always talk about the ideas that they might have. From my perspective, what I have continued to say to my colleagues in both the Senate and the House, in daily calls, hourly calls, is we ought to do 4 things right now. We ought to take care of families and individuals who have lost wages and who face having their basic needs not met. Secondly, we have to provide extraordinary support to our healthcare systems because they're feeling the brunt of it, and that's workers and systems. The third thing we need to do is to make sure we're giving support to our government partners, and those partners like the county, the city, the state, make sure they have the resources to do what they need to do. And then finally, to help with small business and others who face issues that relate to debt service payments, et cetera, that could put them out of business permanently. So we're working on all of that at the same time. In my mind, all those other extraneous issues need to get knocked out of the bill, both the Senate side and the House side. Let's get to the emergencies. Let's get to the real needs. We will have time in a 4th package and a 5th package and a 6th package to do the kind of stimulus things that people are talking about, much of it well-intentioned. From my mind, we need to deal with immediate needs today and the needs that we're going to need in our healthcare system for the next several weeks. That ought to be priority 1, and that's what I'm continuing to urge my colleagues to do.
Thank you. That ends our round of reporter questions. Monroe County Executive Adam Bello will say a final few words, and then we'll wrap it up.
Okay, great. Thank you all for joining us today. I want to again thank Congressman Morelle for his work, and Jaime Saunders from the United Way for the work that she's doing, bringing people together, and of course Julie Phillip from my office for moderating the questions from the media. Just a couple last final thoughts, and to build off a question that I fielded earlier too, is that I will realize that over the last week and over the next several weeks, a lot of news that comes out because of the numbers that are reported, the losses that we're having in our community, is a lot of bad news, and it can build that sense of hopelessness and fear in a sense that there's not a lot that we can do. But the way we respond to crisis is something that Americans have done for generations and centuries, really. And the way we respond is that we recognize there is something we can do. There's something every single one of us can do. If you're an essential employee, you go to work and you protect us and you keep us safe. If you're a non-essential employee, we support those essential employees by making sure they have the resources they need to do their jobs to protect us. And then we do what we can do to stay home and stay apart and lower the curve and spread out the spread of this disease. That's what we can do. We're going to get through this. We'll do it together. But if we realize that this isn't helpless, we are not hopeless. There's lots of hope, and there's lots of ways that we can all help. We have to stand up and work together and do it together. And so I'd like the media to please put out the call to help here today and put those resources together. The United Way has the volunteer portal and the ability for anyone in this community to donate funds to the much-needed community-based organizations that are providing those essential services. And then we also have at monroecounty.gov links to all those resources, including the United Way. We have resources for folks at home when it comes to child care, food access, things of that nature. And then again, to put out there our partnership with Rochester Works. If you are an employer who is looking to size up right now to deal with this crisis and you're performing an essential business, you can log in and register right there to advertise your jobs. And if you are a job seeker who would like to perform one of those essential services, you can go to that website as well and hopefully link up to a job that you can perform. Again, it's all through www.monroecounty.gov. Thank you.